Okay. Hi Claire, can you hear me? Are you able to type in the chat bar? Okay, welcome everyone. Good evening. I hope you can see the presentation in front of you. I've shared the PDF, so that should be crystal clear for you all. What we're going to do this evening is we're going to talk about really the principles of functional medicine. I think it's really important to get the understanding, the principles, and the key concepts of functional medicine across. Um, Hello, everyone. And then we're going to move on to the Advanced Academy as well. So it's really going to spend the first half, we're going to bring across the concepts. And then I want to get a little bit more practical and clinical for you guys. So there's some things that you can take away into your own clinics or into the consult rooms at the gym, essentially from tomorrow morning. So let's get started. I use this slide that I know Dr. Tom O'Brien uses as well. I think it has quite a lot of merit for this evening as well, partly because obviously we've only got an hour to go through quite a lot of content. So I apologize in advance. There are some slides that we might go quite quickly through, but I just want to try and make sure that you guys can leave in 60 minutes time with a good vibe for functional medicine and a good vibe of what to expect if you're interested in the Advanced Academy with Body Type Nutrition. So we're going to cover the principles and key concepts. We're going to also look at a few documents that the Institute of Functional Medicine have created, which I think really do help us sort of think as a functional medicine practitioner. I'm sure most of you are aware of Chris Kress's work, and he kind of sort of talks about being a health detective. And I think there are some key concepts for us to appreciate so we can all become our own health detective and health detectives for our clients as well. And there's a few slides that I've included as well directly from the Academy that we'll discuss in regards to cardiovascular disease, inflammatory bowel disease, and also cognitive function. Three very appropriate conditions, I think, in the modern world to discuss. So what is functional medicine? There are various ways to talk about it. I've chosen 5 key principles. Some people sort of talk about it as an evolution in the practice of medicine. And I think one of the reasons why it's an evolution is because it addresses healthcare needs of the 21st century, which ultimately are a lot more chronic than they are acute in nature these days. And as functional medicine will really try to get to the underlying mechanisms contributing to the expression of disease, and it will take an individual perspective, and it will look at biomarkers and be more proactive and preventative in its approach. I think it's better fitted to a model whereby chronic disease is the real issue. This is a lovely quote that I think helps us look at point 3 in regards to what is functional medicine. It's a quote from Jeffrey Bland. If you aren't aware of his work, he's ultimately the founder of functional medicine in the Institute of Functional Medicine, one of the most intelligent guys, I think, on the planet when it comes to health and disease. And his quote is this: "Disease is a delusion. Your heart disease is not the same as mine. Everyone with type 2 diabetes is not just like everyone else with type 2 diabetes. These so-called diseases are dysfunctions of each individual's physiological functioning. They are due to varied causes, and they demand treatment approaches as different from one another as are the individuals." And this is just a huge factor for us to appreciate. And as a result, functional medicine, as we mentioned earlier, is very much a patient-centered approach. There's plenty of research out there also to back up how important and why this point is so important. And moving on, some of these concepts are very much interrelated as well. So this is kind of a bit of a tongue-in-cheek comic book sketch. You're not ill yet, Mr. Blenzel, but you've got potential, which kind of, I think, brings us to our 4th concept, which is functional medicine addresses the whole person, not just isolated set of symptoms. So this is something that I know I've drilled home a lot in the Facebook forums. for body type nutrition a few times now, which is we can't focus on the disease or the constellation of symptoms that our clients are expressing to come up with a nutrition, supplement, lifestyle strategy to support them. We need to listen to the individual and we need to treat the individual. Go back to Jeffrey Bland's quote. The strategies we need to support our clients, even if they do have the same diagnosis, symptoms, or condition, could be incredibly different, because the underlying mechanisms contributing to the imbalances in that person's physiology may be very different and therefore needs different strategies. So this is a huge point for us to consider. Now, the comic book sketch in some ways isn't tongue-in-cheek, because I've had plenty of clients over the years who have gone to see a previous practitioner, being told they're borderline in regards to reference ranges with blood tests that they've had done. And they've just been told, come back in 6 months, you'll most likely be out of range and then we can treat you, i.e. you then can have a diagnosis, and when we give you a diagnosis, there is a medication that goes with that. And that's happened on several occasions with just the clients that I've seen. So this is something that functional medicine obviously has an opportunity to help with. We don't want our clients getting to a stage where they're getting a diagnosis like that. And I think we fit nicely into that kind of continuum where we can help them prevent them getting from that to that position. And then the fifth of the final points really is that the clients needs to be in control and they therefore need to be in the driver's seat. So again, there's lots of very interesting research out there in regards to this. We know there is a positive influence of quality communication on health outcomes. So this partly comes down to our ability to explain to the clients in ways that they understand the reasons for their physiological imbalances or condition or symptoms. And also, obviously, the strategies and the things that we can put into place to restore those imbalances. We need to recognize and acknowledge, therefore, the patient's experience of illness, understanding the client's view of the world and their concepts and belief and understanding of the disease is going to have a huge impact on the success of your relationship with them and the program that you do design. So in that point of view, we also have research that shows us the more actively involved the patient in making decisions about their treatment, the better the clinical outcome. So we are really the guides. We can show the client which routes they can take while they're in the driver's seat, but they have to almost be the authoritative figure, I think, within that relationship. We can support them as best we can. And on that note, perceived self-efficacy, so the client's belief in their ability to cope successfully with whatever problem, condition, disease they have, is a cognitive mediator that determines coping with illness. And a mediator is essentially something that keeps the disease or that current state going, which we'll get onto in a little bit more detail in a second. But with these things in mind, understanding that the client needs to feel like they're in control, they need to have understanding about their conditions. There are all sorts of different questions and techniques we can use to support our client get there if they aren't already. So, for example, we could ask the client on a scale of 1 to 10, 10 being the most important thing in their life right now, how important is it for them to improve their health or essentially to achieve the goal that they've set coming to see you? So if someone comes to see you to improve their blood pressure or their digestive health, what sort of importance are they placing on that goal? Once you know that, using the same scale to ask your client about confidence can really shed light on what's the first step that needs to be taken to support that client. So if you have someone who says it's 10 out of 10, it's the most important thing right now for them to improve or to focus on, but their confidence in actually being able to achieve that change is, let's say, a 2, then there's a real issue here. There's no point creating a program, being the authoritative figure, and then saying good luck. If they don't have the belief that they can change, it is not going to occur, obviously. So we need to ask around that. We need to step into the client's shoes and appreciate where they are in their journey. And we need the skills or the network to be able to refer out to support them in that aspect of the journey before we're going to be able to bring in too many nutrition, supplement, exercise, lifestyle strategies. So let's say someone is a 2, you could ask them why they aren't a 1, so we can get some what we call change talk going on here. So what are they doing already which is giving them some confidence that they can change? You could ask them what needs to happen for them to become a 3 or a 4. I.e. giving them an opportunity to reflect on this situation and actually think what needs to happen for them to have more confidence. Is it a knowledge thing? Is it a results thing? Is it from previous experience with practitioners? No one's really been able to help them over the years. There's all sorts of things that will contribute to that confidence. And those are all things that we need to be able to shift in some shape or form to support our clients. The stronger their beliefs, the easier it will be for them to change. Obviously, it's self-perpetuating. You could ask some other questions. How much control do you think you have over their symptoms? Another key thing to step into your client's shoes about. And how much social support do they have? Again, going down the psychoneuroimmunology route, we know that people who are alone have suppressed immune systems if it's for too long from taking blood draws of those sorts of clients, etc. So there's some really interesting information, and there's some very powerful things we need to be thinking about in those initial consultations before we get into the stuff that we may really love, which is obviously the pathophysiology, the nutrition, the exercise, etc. So as a result of that, the 5th point is practitioners, we really need to spend time with our clients. We need to listen to their stories. We need to look for the interactions between genetic, environmental, and lifestyle factors. If we can understand those interactions, if we can understand the client's story and their journey, we're in a much better position to be able to support them as a guide, with them still being the authoritative figure. And a key thing for functional medicine is also that we want to try and get that expression of health and vitality, which isn't just being symptom free. There's plenty of people walking around there saying that they feel okay. That's not really what we're after for. Obviously, the client has the ultimate goal, but our hope and our desire for our population, for our clients, etc., is a real abundance of vitality. We want our clients waking up saying that they're feeling absolutely awesome and fantastic, rather than just symptom-free or okay. And that's a long journey for some of our clients, obviously, as well. So why do we need functional medicine, and why do we need to think in this sort of way? Well, obviously, we're aware that there is a sharp increase in the number of people suffering with complex chronic disease. Some of the statistics are scary. On the Advanced Academy at the moment, we're looking at cognitive health. In one paper that we were discussing, their expectation is from 2020 for dementia to double every 10 years in the UK. System of care is orientated towards acute care at the moment. We've already discussed this, really. So functional medicine is in a much better position to support clients struggling with these complex chronic diseases. And therefore, we could say that the acute care approach or model lacks those sorts of tools needed. There is a huge gap in research, and there are all sorts of different statistics out there. And this places a huge responsibility on each and every one of us as a health practitioner, because depending on what you read, what I've read is anywhere from 17 to something like 40 years is the gap between the research coming out today and it being commonplace in clinical practice. I.e. the research paper that came out today on X, Y, or Z is going to take maybe 10, 15, 20, 25 years to be commonplace with us as practitioners using it. So this is why it is a constant state of education if you're going to be in the health and fitness industry. And this is really important for us to appreciate. It's one of the arguments why we should all go and specialize in an area, because it's just impossible to stay up to date with all of these different things. We need a grounding, I think, in functional medicine and systems biology, which we'll discuss in a second. And then maybe we want to look at where our interest and passion lies, so we can really stay up to date and become a real specialist in that area. And as a result of all of this, essentially, there are several physicians that are just not adequately trained to assess underlying causes. Go and speak to the docs, etc. I've spoken to a lot through the IFM journey. They have maybe up to 5 hours of nutrition training within their 5 years of study. And in certain schools, the treatments are completely orientated around what is the medication that you give to the diagnosis. and that is the protocol that they look at. So it's not their fault, essentially. There are lots of different reasons behind this, and we need that aspect of medicine, but we need to also understand that functional medicine is complementary and should be working alongside these conventional physicians for the best chance of our client experiencing that optimal vitality. So how do we kind of relay this information in a short and concise way, in a way that also that the clients will understand? Well, at the Institute of Functional Medicine have what we call the functional medicine tree, which is a great way of explaining to clients in a very quick terms, the concepts we've been talking about. So really, conventional medicine works in the branches and the leaves of the body. For example, if you have symptomatology related to cardiovascular health, you may go and see a cardiologist. They look at those cluster of symptoms, they look at that branch or those leaves, and they'll give you a diagnosis and maybe a medication to support you. Same from a gastroenterology perspective or an endocrinology perspective, etc. Now, I'm not a conventional medicine basher. I'm just giving you some examples of my experiences here, where I've had clients, very much looked down upon and almost laughed out the room by a consultant who doesn't appreciate that, for example, digestive health and hormonal health could be at all related. They have their speciality, they're exceptional within that, but they have lost the understanding that all of these biological systems are interrelated. Now, naturally, a lot of us as personal trainers, nutritionists, we've been trained that way anyway, but we work from more of the roots. So we go to the exercise and to the movement of the client. We go to their sleep and relaxation, their relationships and their stress management and their nutrition. And we look at those as underlying issues that may be contributing to their expression of health or disease. Functional medicine will also look into things like genetic predispositions. We all consider their mindset and mental health, etc. And then we have these terms: antecedents, triggers, and mediators. Antecedents are ultimately things that predispose us to a condition or disease. It could be a family history, it could be related to the pregnancy, it could be related to a period in someone's life when their nutrition was poor or their stress was high, etc. Triggers, as the name suggests, are things that trigger the onset or expression of those symptoms, condition, disease, and mediators are the things that keep that disease going. Now, they're not black or white. A mediator could also be a trigger and an antecedent. So a period of stress in someone's life could contribute to or predispose them to IBS, for example. A trigger could have been a particular acute episode of stress, and the mediator could be the fact that they're just still under constant stress. So it isn't black or white, and there are lots of things that are going to tap into that. Interestingly, what we start to see is there's a lot of information we can go back to from an antecedent perspective around the pregnancy and the family history of a way of kind of questioning and asking around that aspect of things. Triggers are not always very apparent. A very obvious example would be a client who went to a tropical environment, picked up some sort of tummy bug, came back and has never been right. And therefore you may be thinking about a parasitic infection being a trigger to their IBS type symptoms. And the mediator may be the parasitic infection that still hasn't been eradicated, so to speak. So essentially, functional medicine take a roots up perspective. Conventional medicine often will take a leaves down perspective, so to speak. And these are kind of the terminology that we just mentioned. I think when we start to use these sorts of terms or just think in this sort of way, it really does make a difference, which is why I want to kind of hit it home this evening. Thinking from a functional perspective will revolutionize the way you treat some of your clients and some of the suspicions you may have in regards to what's contributing to their problems. We then have the functional medicine matrix, which is essentially a document we can use in clinic. And you guys will be able to, I think, there are examples on things like Google Images of this sort of document, which we can use to help brainstorm and mind map where we need to go to support our clients. So on the left, you've got your antecedents, triggers, and mediators. So you can fill those in and then tell that story back to the clients. On the sort of top right, so to speak, in the box, you've got your actual matrix. So this is where we take notes of symptomatology which relate to one of the bodily systems. Assimilation is essentially your gut. Structural integrity could be related, for example, to the skeletal system, or I'll put things like cellular integrity in there as well. Communication is your hormonal system, transport, cardiovascular health, biotransformation and elimination, liver and detox pathways. Energy can be things like the Krebs cycle and glycolysis and the electron transport chain, so mitochondrial health. And then you have defense and repair, things like your immune system, any suspected or known inflammatory issues, etc. And Christy Hughes, who's one of the faculty members at IFM, has the saying, which is, where is the ink? I.e., if you use this document to record your client's symptoms, their story, etc., rather than, let's say, just a blank piece of A4, then wherever you've got the most ink, wherever you've written the most amount of information is quite likely where you need to go to support your client. And one of the huge things we start to see, and as a lot of us appreciate in the health and fitness industry, is often we're going to things like digestive health, even if their symptoms traditionally wouldn't be associated with imbalances within the digestive tract. So going from this perspective sometimes can really help us. And it also is brilliant for your clients to see how all of these things interconnect. And sometimes they have really eureka moments or jaw-dropping moments where you explain to them how these systems are interrelated and how their current symptoms root back to an imbalance within the digestive system or within the hormonal system, etc. And then obviously you've got your lifestyle factors that you can record as well. So it's like a real kind of go-to document that we can use to support our clients and record the information when we want to go back and have a quick look at, what we were doing with our client, maybe when we saw them 6 months ago or whatever it may be. So this is kind of how we lay it out sort of in the academy as well. So I just put little pictures there, and then we kind of go on a journey each week to see whether a imbalance in one of these biological systems or one of those lifestyle factors relates back to the topic of that week. So if we're talking about cognitive health, essentially I'll spend the week researching the topic to see what out of these factors may we need to consider when we're supporting clients. Or let's say that someone has a family history of Alzheimer's and they want to reduce their risk of being diagnosed. What are the things we can do to support them? And often we'll find that every single one of these little kind of boxes will come back to the disease or the topic of the week. We also have the timeline, which I think, again, is just very important for us to appreciate. We're nearly done from this side of things. And again, it's a way of just recording information for our clients and essentially then reciting that story back to the client so they can see it from a slightly different perspective. Every single client we see, especially if they're coming to us, obviously, to have support with a condition that they're struggling with, we want to ask some questions going back potentially to their grandparents. Now, this is where obviously information can be quite sparse. A lot of our clients may not have much information, but we can still ask the questions. Sometimes they'll be able to go away and ask. But we know from some epidemiological research, looking at, for example, the Dutch famine during World War II that the Nazis put on, we are now aware that the health and the environment of our parents, and soon I think it's very likely from a human perspective we'll see with our grandparents through the research, can have an impact on our development as a child and the expression of health or disease in adolescence. So we sometimes need to go that far back to understand the antecedents, triggers, and mediators of our clients. If we can't go that far back, then that's fine. We go as far back as we can. We can talk about prenatal environments, the health of the mum and dad, the nutrition, the environment. Were they smokers? Did they drink during pregnancy? Were they active? What was their diet like beforehand? We can talk about the pregnancy, the weight at birth. Were they full term, preterm? That has an implication for various conditions like cardiovascular disease and metabolic disease. So just knowing even that gives you an indication of, are they predisposed to certain conditions? We can ask about the childhood. Are you aware of how many infections, if any, there were? What was their nutrition like? How long were they breastfed for, if they were? And the journey goes on in that initial consultation. Gather some information almost by the decade, really, depending on how old they are, to get an understanding of what's going on. And sometimes you'll see within that timeline a real specific trigger. It may be that holiday to Egypt. It may be a change in job. It may be a horrible period of stresses with bereavement, etc., over the course of a year or two, that really then led to the dominoes falling over, i.e. that was the trigger that led to just a decline in their health until the current day. Now, if we go back to kind of almost our mindset and life coaching, we can take that one step further and actually have a brief discussion with our clients about their future timeline. So what's their vision about their future health? What is it that we're actually trying to achieve and create here? And then we can put some time frames on that. What's the 6-month video that they're playing in their mind that they want their life to look like? What is it at 12 months? What is it 3 years? What is it 5 years? So we can take some of those tools we use from a business perspective and put that into the health world as well. And I think that can be very motivating for our clients. And it goes back to some of the questions that really we were looking at earlier. So moving forward, I think we're doing quite well for time, luckily. We're going to kind of, hopefully around 10-minute journey, looking at kind of the 10-month journey that some people are currently on, and hopefully some of you will be on at some point in the future as well. Now, essentially, the Advanced Academy is laid out as much as it can be in kind of a functional medicine timeline perspective. So we have an introductory call to begin with. We then talk about transgenerational disease. So we look at the research from things like the Dutch winter famine in 1944. We talk about prenatal programming, the impact that the kind of intrauterine environment and the kind of environment of the pregnancy can have on the programming and development of the fetus and the child. We then talk about fertility, and then we kind of go through the life stages as best we can. We spend probably 3 or 4 weeks on digestive health. We talk about cognitive health, cardiovascular health, etc. And we just take it 1 week at a time in regards to this timeline. Obviously, there's a bit of back and forth. You can't really avoid that. But one of the examples would be thinking about sort of fertility and preconception. So there's some really interesting information out there in regards to this area. It all started with the Barker hypothesis, which was related to kind of the weight of the baby at birth and their risk of cardiovascular disease or metabolic syndrome later in life. And it's kind of all stems from there, really. But we know, obviously, it's kind of common sense. But nutritional status prior to conception is incredibly important for the health of both the mother and the infant. Pregnancy is an incredibly stressful state for the body. The hormonal changes that occur are just overwhelming. There's jaw-dropping, some of the things that happen from the estrogen, cortisol sort of perspective. And we need to therefore make sure that the mother is in the best position possible to support herself and the baby during that period. So we do spend 1 week talking about kind of transgenerational disease and this area of kind of preconception. Essentially, you're looking for a minimum of a 3-month period, ideally, before your clients try and then conceive. So you've got that 3 months where you can optimize the health of the mother and the father, and really give them the best chance of getting pregnant. And then we talk about the prenatal talk, where there are lots of research out there. Again, we can go back to each system within that matrix and talk about things. We know, for example, that an active immune system, or I should really say something like an upregulated immune system of the mother, maybe due to something like an infection, can have an impact on the development of the fetus through various mechanisms, including the production of cytokines, those inflammatory molecules, through glucocorticoids, so things like cortisol, and through nutrient requirements as well. So if a mother is going into a pregnancy with a upregulated immune system, an active viral infection, a bacterial infection, an imbalance in the endocrine system related to insulin or the thyroid or the adrenal glands, etc., these sorts of things are going to have a real impact. So my opinion is we really want to be screening all of our clients before they try conceiving for some of these things. And the way you screen may be based on how that matrix is filled in. You may end up going and looking at doing something like a stool test because they're struggling with bloating, etc. We know there seems to be a correlation between the health of the gastrointestinal tract of the mother and, again, the health of the fetus and the baby. So we want to optimize our client's health as much as we can when we move forward through their journey. And this, again, is just kind of an example paper of the things that we need to be thinking about. This kind of talks about chemical contaminants in breast milk. Again, if we go back to this idea that a lot of the toxins that we're now exposed to in the modern world are lipophilic, so they're fat-loving, so they get stored in fat cells. The breasts are essentially a very fatty part of the body, and therefore there's going to be a certain degree of attraction of toxins to the breast. And we do see through sampling of breast milk that there are some of these chemicals and pollutants in there. Now, obviously, there's a threshold where it's not going to be an issue, but I think the research is becoming pretty evident that low grades chronic exposure to some of these toxins, which are viewed as non-problematic, are problematic. And there is a wealth of research now out there in regards to this area, which a lot of people kind of discredits for various reasons. But again, if you go and look at what's available, there's some pretty interesting data out there now in regards to this. And that's another reason why that 3-month minimum period before conceiving is so important. If we can support our clients and if we can reduce their toxic burden, as practitioners will call it, we're doing a huge good for not only that mother, but also the child 9 months down the line. And then again, just an idea. So with the timeline, we do spend an entire week looking at just the gut-brain axis because it's such an important part, I think, of our clients' health because of the amount of stress a lot of our clients are under. So when we look at gut health or the gut-brain axis, if any of you came to the BTN conference last year, you know that I spoke about this. The gut-brain axis is a really interesting area of research. There was a textbook that came out last year called Microbial Endocrinology, which is kind of the most up-to-date resource we have in this area of health. And the gut-brain axis is actually more than one axis, really. There's 3 or 4. So looking at that diagram, we have the vagal nerve, which is a neurological pathway between our digestive tract and the brain, which can have an influence in both directions. So the gut can influence the brain and the brain can influence the gut. We have an endocrine pathway via hormones like cortisol and thyroxine. We have an immune pathway via cytokines that can influence the brain. If you aren't aware, there is a lot of information out there in regards to dementia and cognitive health, and inflammation is one of the key underlying mechanisms that contributes to it. Cytokines, inflammatory molecules that can be released or synthesized through various immune cells, can influence the brain through the vagus nerve or through leaky parts of the blood-brain barrier, where they'll activate various cells in the brain, which can contribute to neurodegeneration. So really interesting stuff out there in regards to that. And then we have what I call a metabolic pathway, which are things like neurotransmitters synthesized from our bacteria. Various bacteria in the gut are able to synthesize adrenaline, noradrenaline, serotonin, dopamine, GABA, etc. And then we have our short-chain fatty acids, which help heal or important for the epithelial layer of our digestive tract, and therefore important in reducing the risk of leaky gut. But these sorts of metabolites can also influence cognition in various ways as well. So those are 4 paths that we can consider with our clients. And it's probably heavily involved in our clients who have things like IBS, where they say they have a nervous tummy, for example. Now, there are things we can do to modulate all 4 of those pathways as well. We can support and remodulate the immune system to reduce the overproduction of cytokines. We can bring in stress management techniques, and we can investigate what's driving up cortisol production. We know that cytokines can suppress and activate the HPA axis. for example, and therefore remodulating the immune system can remodulate cortisol production. There's a lot of information out there now in regards to, if we'll use the term adrenal fatigue, but essentially adrenal dysfunction. If someone's flatlining in cortisol levels, is it the glands that's the problem? The majority of times not. It's more likely that there's some form of inflammatory state which is suppressing the HPA axis, for example. So we can remodulate that through indirectly or by indirect means, and by looking at things like the immune system. There are various techniques that you can consider from a vagal nerve perspective. Some very simple things like gargling, for example. Singing loudly can activate muscles in the back of the mouth, which helps stimulate the vagal nerve. I think more often there are other factors like metabolites, inflammation, and stress through a hormone perspective that we'll be looking at there, though. And then we do look at cognition, for example, as well as aging and the theories of aging that are out there. And again, this is just an example paper, really, which discusses probiotics and prebiotics and their beneficial role in the elderly for various reasons. And again, we've just seen how those may be able to support healthy cognitive health. Human studies, for example, have been done using probiotic supplementation and MRI scans and seeing sort of brain changes and different activation in parts of the brain through supporting the digestive tract. In animal studies, we've also seen that by cutting the vagal nerve, those benefits are no longer seen. And that's kind of conclusive evidence that the vagal nerve is a bidirectional pathway between the gut and the brain. So let's look at some specific examples. We're going to take 3 slides from 3 talks in the Academy, just to kind of give you an idea of kind of where we go with things. I've become really kind of interested in cardiovascular health since the cardiometabolic module with IFM. And in a nutshell, I think Dr. Mark Houston's quote really sums this up well, which is there are an infinite number of insults to the endothelium of the blood vessel, or essentially to the cardiovascular system if we keep it a bit more general. We can break those infinite insults into biomechanical, things like blood flow or pressure, and also biochemical, so hormones, nutrient status, various antigens, bacteria, viruses, etc., environmental toxins like heavy metals, like mercury, for example. All of these sorts of insults are able to damage the endothelium. The thing is, there's only a finite response from the endothelium: inflammation, oxidative stress, or an immune response. Those, or one of those 3, contributes to vascular disease. So when we think of supporting our clients with cardiovascular disease, we know that there's going to be at least one of those finite responses there. We also need to go back to those infinite insults and investigate what is the insult contributing to the response. Now, at some stage, it becomes very hard to start at the bottom and work our way back, i.e., if you know there's inflammation and all you do is try and modulate the immune system to reduce the inflammation, you're going to probably have a very hard time balancing things out because you're not dealing with the underlying mechanism. However, if you find that there is a bacterial infection which is activating one of the receptors on the endothelium, so if you look at those gray blocks attached to the blood vessel, you have the toll-like receptors, you have pattern recognition receptors, PRR, you have nodes, and you have calveoli. These are receptors which are able to sense various molecules or patterns on other molecules. So for example, toll-like receptor 4 can detect lipopolysaccharides, which are breakdown products of gram-negative bacteria from the intestines, for example. Pattern recognition receptors, of which toll-like receptors are a group of that or a subset of that, will recognize what we call PAMPs or DAMPs. Now, PAMPs are pathogen-associated molecular patterns. These are, if we keep it kind of a bit simple or general, these are sort of like barcodes on bacteria and viruses and the like, which the receptor detects and then will stimulate a response, which essentially is the production of things like cytokines and inflammation. The DAMPs are damage-associated molecular patterns. These are more endogenous. So DAMPs, or these damage-associated molecular patterns, can be things like cellular debris from apoptosis. They can be things like advanced glycation end products related to high blood sugar levels, etc. These internal alarmins, as some people call them, are the things that stimulate these receptors that lead to the finite response. And you get in these vicious cycles, obviously, as well, because inflammation will contribute to oxidative stress. Oxidative stress in its own right will contribute to inflammation, and an immune response will lead to inflammation and oxidative stress. So this is why going upstream to the underlying issue that's contributing to all of this is going to give you the biggest bang for your buck. And if you think about this, it is a complete revolution in how we support our clients with cardiovascular disease. If we start to think that someone's gastrointestinal health could be the underlying issue, if we think their immune system could be the underlying issue, etc., then it's a very different approach to a conventional approach, or approach that maybe we've taken in the past without this knowledge. Dr. Mark Houston did a clinical study not that long ago where they gave a group of people with hypertension, they did a micronutrient assessment, they restored micronutrient levels based on those results. Within 3 to 6 months, the majority of those clients were off their antihypertensive drugs. It's a very effective way of supporting this, and there are some key nutrients that will often come up, CoQ10, magnesium, etc. But it again does need to really be personalized around the individual, because we're all going to have our unique set of micronutrient deficiencies. But if we think about it, if there's an infinite number of insults that impact or insult the endothelium, but there's a finite response, if you aren't available to test, or if they can't afford to test, or whatever it may be, then your next best bet is to go after the 3 finite responses. An anti-inflammatory diet, maybe bring in some anti-inflammatory nutrients if possible, even just some good old omega-3, for example. Reducing their oxidative stress as much as you can from a lifestyle perspective, and supporting the immune system or remodulating the immune system, probiotics, vitamin D, vitamin A. There are various things that you guys already know what to do in regards to that, is going to also support them to some extent in the long term as well. So cardiovascular health is a really interesting area, and again, there's lots of different research out there supporting this sort of approach. When we look at gastrointestinal health, this is a slide we use in the inflammatory bowel disease talk. Again, a really, really interesting kind of area. Digestive health, I think, is where a lot of nutritional therapists and health practitioners go to for obvious and right reasons. But we also need to appreciate that this innate immune system, which essentially lines that kind of epithelial layer, we come back to almost every single week in the Advanced Academy. We've just mentioned how the innate immune system is involved in cardiovascular disease sometimes. The innate immune system isn't just located in the digestive tract, it's along the epithelial or the endothelial layer of our cardiovascular system as well. So we have our toll-like receptors, for example, on the epithelium of our digestive tract, and they're detecting various DAMPs and PAMPs, for example. Now, from this perspective, we can see in inflammatory bowel disease that along the epithelium, which is kind of the lining of the digestive tract, I sometimes explain this to clients as if you imagine a hose pipe, the actual pipe itself is the epithelial layer. And on the inside layer, we've got a bunch of very specific and different cells that have different roles to play. One of them is the M cell. The M cell is there to help sample food, bacteria, products within the lumen, within the hose pipe itself, or the pipe. And underneath the M cell, we have often either something like a Peyer's patch or the mesenteric lymph node. So kind of like an immune site, basically, because there's a lot of sampling happening. We also have dendritic cells, and the dendrites, or the arms of these dendritic cells, also are able to reach out into the lumen and sample products. So they'll reach their arm out, they'll grab something, bring it back in. It will go to the Peyer's patch and to the mesenteric lymph nodes, where essentially it can be presented to an antigen an antigen presenting cell will present it. And this kind of mechanism then primes the immune system. So we get a Th1, a Th2, a Th17 response, and those sort of immune responses will then contribute to the production of cytokines in an inflammatory state. And again, there are various things we can do from a nutrition and lifestyle perspective when we start to understand these processes. So vitamins A and D, for example, are incredibly important in oral tolerance. The ability of this immune system and the epithelial layer to detect friend from foe. So a deficiency in nutrients is going to have an impact on this kind of innate immune mechanism that we see. So again, it's important, I think, always kind of, if we're going to be explaining these things to our clients, to also give them the confidence that there are things we can do from a lifestyle perspective to obviously remodulate and support these processes. And then we've already talked about cognitive health a little bit. This is a kind of a useful visual for us from a very interesting paper which discusses how cytokines may be a trigger or a mediator of depression. And one thing we mentioned was obviously how cytokines can activate or influence brain activity through the vagal nerve. We mentioned how they can also do it systemically through either leaky parts of the blood-brain barrier or through actually causing excess or extra leakiness of the blood-brain barrier, and therefore getting into the brain where microglia and astrocyte cells, which are part of kind of the brain's immune system, can get activated, where they then synthesize cytokines. And that inflammatory state has an impact on various aspects of brain function. I think they'll have an impact either directly or indirectly on things like brain plasticity as well. So kind of remolding the brain, so to speak. They also do have an impact on the neurotransmitter pathway. So they can influence things like the serotonin pathway, the dopamine pathway, etc. Excuse me, those cytokines will also be able to contribute or affect the HPA axis, as we mentioned earlier. Glucocorticoids, chronically synthesized, may contribute to an inflammatory state in their own right if we see a suppression in cortisol as a result. So long-term stress through various mechanisms could actually contribute to an inflammatory state in its own right. So again, we need to appreciate that there are some very interconnected pathways in all of these different situations. So that gives you hopefully kind of a little sample of where you need to go or where we can go with the Academy, but also gives you some things to think about and some areas to go and perhaps research in regards to some very common conditions that we see probably in our clinics daily or weekly. So just to kind of finish with an idea of, if you're interested in the Advanced Academy, just to give you an idea of kind of how it operates, it's currently a 10-month course. We introduce all the key concepts of functional medicine. We spend each week essentially going through the matrix, looking at the condition or the topic for the week. And really, obviously, as always, it aims to take your nutrition to the next level. I do think it really puts you in a great position to work with clients that perhaps you weren't confident enough to work with before, but the deeper understanding you have and the mechanisms that we repeatedly come back to from a functional perspective will give you more tools in your toolkit to be able to work with these complex chronic conditions. But also, most importantly, give you strategies, obviously, to modify those mechanisms and support those sorts of clients. It essentially is starting at the very beginning of April if you are interested, so please get in touch with us if you are. It's taught online. It was going to be every Wednesday, 8:30 to 9:30 p.m. It's taught by me, and we have kind of a Facebook forum where we can talk about client cases. You can ask questions in regards to the talk and obviously make sure that you're understanding things, and you get access to the audio files. So I record the lectures that you will then have to re-listen to as many times as you want. You get a folder so you can put all of your stuff in there, and you do get access to examine.com, which I do think is a huge benefit that Ben has been able to organize for us all. It's a brilliant monthly document that we get that we can read, and it does make a difference, I think, from a clinical perspective. And I'm kind of in the process of really trying to help the students as much as possible. So there are some template GP letters. I do speak to the guys about the importance of keeping the GP in the loop, especially with some of the more complex clients who may be struggling with certain conditions. I'm also in the process of creating questionnaires that we can use with our clients that just make thinking as a functional medicine practitioner that much easier. If you've got it there in front of you, then obviously it makes the whole process a lot smoother. And there are various documents that we can use, clinic documents using some of the visuals, for example, that we've gone through to help explain to our clients and give them the confidence they need to move forward in their journey of optimizing their health. And then, as always, it's an academy that's very much in control by the students. So any feedback that we can get is obviously going to be of huge importance to us. And there are also various links and articles for reading every single week as well. So you get access through a Dropbox folder to essentially dozens of different papers of different sorts to help further your development and understanding of these issues. So I do think it's a very useful academy. Obviously, I am slightly biased here, but it's something that I'm extremely proud that we're able to kind of offer. And I do think if you have any interest in supporting that sort of client, a client with any sort of chronic disease, be it cardiovascular disease like hypertension, be it inflammatory disease, IBS, etc., then it's certainly going to be able to help you from that perspective. And obviously over the 10-month journey, you've got access to me via the Facebook, etc., to support you there as well. So that's all for today, folks. I hope you have found it interesting and beneficial. If there are any questions that you're burning to ask, obviously you can find me on Twitter and Facebook, and we can kind of clear anything out for you. Any questions, then just head on over there and we can get them ironed out for you. The next one, if you know anyone who is interested, we're doing this again on Tuesday evening at 8 o'clock. So if anyone wants a last minute kind of process and to see whether they're interested in the academy that starts in April, then there's another opportunity. So obviously it'd be greatly appreciated if you have any friends, family or colleagues who you think might be interested in this webinar, just to pass it on. So finally, guys, thank you very much for attending on and me taking up your Sunday evening. I hope you found it beneficial, and hopefully I will speak to you all soon. Thanks, Kate. Thanks, Sanjay. Cheers, guys. I'm glad people enjoyed it. No worry, Laurie. If you're around Tuesday, obviously jump on board if you want to hear that. Yeah, Tuesday evening at 8 o'clock, Laurie. Exactly the same thing. Thanks, Iona.